Covering all of Southern California, this is Kcal 9 News Central at noon.
Prevent and even eliminate disease through exercise. A local doctor joining us live in studio here in a few minutes to explain how spending as little as 10 minutes, Sandra, a day can actually make you disease-free, or help you anyway.
Well, just a little while ago, we mentioned that new study that shows exercise can stimulate your brain. We also know it can help you fight disease.
Joining us this afternoon is Dr. Ruth Anderson, who believes exercise gives people the power to prevent, decrease, and even eliminate disease. That's a pretty good prescription right there, huh?
That's a great prescription.
Looking over the notes here, one of the shocking statistics that kind of jumps out here is that 61 million Americans have heart disease, which contributes to approximately 40% of the deaths in the United States.
If you take the biggies, heart disease, high blood pressure, and diabetes, they're going to lead to death in 7 out of 10 of us.
Oh my gosh.
Well, I mean, something's going to lead to death in all of us eventually. The question is, you know, do we want that to happen when we're in our 40s and 50s and being a cardiac, what doctors call a cardiac cripple for the next, 10 or 15 years? Or do you want to live a wonderful full life until you're about 80 or 90? My practice is in Palm Springs, so I see the wonderful full lives. But I also see a lot of patients that say, doctor, this was supposed to be the golden years.
Yeah.
And you say we can attain this through exercise. What kind of exercise are you talking about? Is it a big commitment, or is it just a little bit every day?
Well, it depends what kind of shape you're in. The nice thing about being in awful shape is that it takes very little to start to see real effects. And so that's why I say 10 minutes a day is really all it takes. But to start. But you start with that 10 minutes, and depending on the disease, if it's high blood pressure or diabetes or heart disease, walking is the best medicine. You start with 10 minutes, and all of a sudden you're going to go, wow, this feels good. I'm sleeping a little better. I'm in control of my life. My stress is down. And all of a sudden the 10 minutes will go to 15 and ideally then up to 30. I mean, it's not as easy as just 10 minutes a day for all of us, but it's an easy way to start.
And it's pretty startling, the medical evidence that's out there that suggests that, the hardcore evidence out there that doing a little bit of exercise greatly increases your chances of living longer. Oh,
it does. Well, and living well. Even more important than living longer is whatever time we have, you want it to be well. I have a master's in exercise physiology, and I was a dancer long before I ever wanted to be a doctor. And I've taken all the scientific research, and I've just used all my exercise background and put it in a way that people can take this medical approach, know that it's good science, and know that what they're doing is really a safe and effective way to spend their exercise time. We don't have that. You know, if you're 40 or 50 and your doctor says, ooh, you're putting on the pounds, the blood sugar's starting to creep up, your high blood pressure, you're starting to get high blood pressure, you got 6 months. You either drop the weight, get better, or I put you on meds. Then he looks at his watch and goes, oh, I'll see you in 6 months. And the patients sit there and they go, okay, now what do I do?
Yeah.
Where do I go? Trainers are great. If you're 20 and healthy, they know how to put the pins in the machines and get you moving. But they don't know how to give you that exercise program if you have disease or if you want to prevent it.
What sort of things have you seen in your patients? You said you practice in Palm Springs. What sort of changes have you seen when you give them this advice?
Well, I'm a pain management specialist. I'm double boarded, anesthesia and pain management. So my patients have back pain, arthritic knees, and the ones that grab onto the exercise and decide, yes, I am going to take charge of my life, they do better with whatever medications I give them, with whatever injections I give them. The worst thing for arthritis is carrying extra weight, right? So if they start to drop the weight and do little things, like just sitting right now in front of the TV, just doing little things like straightening your leg, it starts to build those thigh muscles again.
Really? Just a little leg lift like that?
A little leg lift. Well, we spend so much time sitting, and that's the other part of the book. There's the exercise part, but it's called Get Moving. And it's called Get Moving because we're becoming more and more sedentary, right? I mean, and the obesity epidemic is just, it's just scary beyond belief. It's because we're not moving. So I tell all my patients, don't push yourself up out of the chair with your arms. Use your legs. The stronger the legs you have, the less pain in your knees, the better your back is. And the more calories you burn day to day and minute to minute.
So
So get moving is really the key.
Saw a little line in the book also about just brushing your teeth. You can actually exercise while doing that.
I tell all my patients to stand on one leg and brush your teeth. Exactly right. You got 2 minutes before your little timer goes off,
Yeah.
right? And you can either stand there or you can practice your balance and strengthen those legs and your core just by balancing on one leg.
Work it into your normal life. Walk,
Day to day,
start
minute by
10
minute.
minutes a day.
And the book is full of these little suggestions.
All
And
right.
we need it.
Great. Dr. Anderson, thanks so much. Here's the book. It's Get Moving, Live Better, Live Longer. Thanks for being with us.
Thanks so much.
For more information about taking charge of your health with exercise and for any information about Dr. Ruth Anderson's new book, Get Moving, Live Better, Live Longer, just go to our website. It's kcal9.com. Click Seen on TV.
Coming up next year, Henry DiCarlo.